I developed a few techniques I want to talk to you about this morning. Natural postural engagement is the main topic, but I'm going to do one of my precursors, which is rhythmic release and restoration. These two go hand in hand, and one of them, the rhythmic release and restoration, is for the more passive child or to somebody that just needs some TLC. And the natural postural engagement is an active participating program. The journey of coming up with this was having a heart for somebody having an easier treatment protocol, us making things easier for our kids and understanding by therapists, because I was like, nobody can go take all these courses to learn all these pieces. There ought to be something simpler. So I just kind of went back to how our vestibular system, our breath, our emotional system, the rhythmicity of the body, the proprioceptive system all tie together. I look at what players are on the field, and by that I mean, is their vestibular system talking to their proprioceptive system, talking to their tactile, talking to their auditory, talking to their visual, or is somebody just really struggling and not bringing the system together? So often there's nothing wrong with the parts, but how they use the parts. So the first technique with rhythmic release and restoration, I'm looking at how in the triangle I talked about of the emotion, the vestibular, the rhythm, and the breath, I'm looking at how breath and rhythm shift to shift the tissue. And I do 3 planes of movement with front, back, side, and the third with some rotation to move the tissue and move some of the motion off of the child's movement patterns or the person's movement patterns. On the second technique, we're actually actively moving, but the whole concept is we have some deep layers and we have some outer layers. And we start with front back, moving in front back so that we can get some of that fear and anxiety and get somebody back to safety, moving them right, left, getting them in the 2 sides of the brain, moving in rotation, getting in the whole brain. But we can move through these patterns, going from as small as a cell and as large as, the whole space and the whole person. We stay in relationship with the tissue. The main piece of this program is the engagement and relationship of ourself to our parts or ourself to somebody else. Very powerful technique for learning to work deeply with tissue and the children or people you work with. It's good for children and adults.